This medication is used to treat symptoms caused by excessive stomach acid, such as heartburn, upset stomach, or indigestion. It works by reducing the amount of acid in the stomach. Be sure to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The recommended daily dosage is usually taken after meals and at bedtime, or as directed by your doctor. Be sure to follow the instructions on the label and consult your doctor for the best timing to take this medication. When taking Antacid Ultra Strength, it is important to follow the instructions on the product package. If you are taking the chewable form, make sure to chew the medication well before swallowing. If you are using the liquid form, be sure to shake the bottle well before each dose. It is important not to exceed the maximum recommended dose stated on the product package. If you have any questions, it's best to consult your doctor or pharmacist for guidance. If your condition persists or worsens, it's important to inform your doctor. It is also advised not to take the maximum dose of the medication for more than 2 weeks unless directed by your doctor. If you suspect a serious medical problem, seek medical help immediately. As for the best time to take this medication, it is recommended to follow the instructions provided on the product package or consult your healthcare provider for personalized advice. If you experience constipation, gas, or burping, it's important to speak with your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you have any serious side effects, such as loss of appetite, nausea/vomiting, unusual weight loss, bone/muscle pain, mental/mood changes, headache, increased thirst/urination, unusual weakness/tiredness, or signs of kidney problems. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Antacid Ultra Strength, it's important to consult your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. If you have high calcium levels, stomach/intestinal blockage, or kidney disease, it's important to consult a healthcare professional before using this medication. Some products may also contain aspartame, so if you have phenylketonuria or any condition that requires you to restrict your intake of aspartame, make sure to talk to your doctor or pharmacist about using this drug safely. It's also important to inform your doctor if you are pregnant or breastfeeding before using this medication. It's important to be aware of potential drug interactions when taking Antacid Ultra Strength. This can affect how your other medications work and increase the risk of side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Antacid Ultra Strength include digoxin, certain phosphate binders, phosphate supplements, and sodium polystyrene sulfonate. Calcium carbonate, which is found in Antacid Ultra Strength, can decrease the absorption of other drugs such as tetracycline antibiotics, bisphosphonates, iron, and certain antibiotics. It's important to separate your doses of these medications as much as possible from your doses of Antacid Ultra Strength. Consult your doctor or pharmacist to find a dosing schedule that works with all your medications. Additionally, it's important to check the labels on all your prescription and non-prescription products, including supplements and vitamins, as they may contain calcium. Be sure to ask your pharmacist about using these products safely. If someone has taken too much Antacid Ultra Strength and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, changes in mental or mood, headache, weakness, and dizziness. It's crucial to get help right away to prevent any serious complications. Make sure to attend all your medical and lab appointments as directed by your healthcare provider. In addition to taking Antacid Ultra Strength, you can also make lifestyle changes to further reduce heartburn and other stomach acid problems. Stress reduction programs, quitting smoking, cutting back on alcohol, and making adjustments to your diet, like avoiding caffeine or certain spices, can all be helpful. It's a good idea to talk to your doctor or pharmacist about any lifestyle changes that might be beneficial for you. When you're experiencing heartburn, indigestion, or upset stomach, Antacid Ultra Strength can provide relief by neutralizing stomach acid. It can also be used as a calcium supplement to help maintain healthy bones and teeth. The recommended daily dosage for adults and children 12 years and older is 2 to 4 tablets every 4 hours as needed, but not exceeding 19 tablets in 24 hours. It's best to take Antacid Ultra Strength after meals or at bedtime, or as directed by a doctor. Always follow the instructions on the label and consult with a healthcare professional if you have any concerns. Remember to store Antacid Ultra Strength at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of the product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard it when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.